No mai haere mai ki te manatū hauora, and also of course Te Wiki o Te Reo Māori, Māori Language Week, which we have a series of events we are celebrating here in the Ministry of Health. So today there is one new case of COVID-19 to report in New Zealand, and this was detected in a recent returnee in a managed isolation facility. There are no new community cases. Today's new case is a woman in her 30s who arrived from Dubai on the 9th of September, and she is related to the 3 cases reported yesterday. Today, regrettably, we are also reporting the death of a man who had COVID-19. The man was in his 50s and was a confirmed case and had been being looked after in the intensive care unit at Waikato Hospital. He was admitted there on August 19 and sadly passed away yesterday afternoon. And his death and some interviews with his whānau and iwi have already been reported in the media. So the man's whānau has asked us to tell the country that coronavirus is so real and to be vigilant and cautious. They have issued a plea to all New Zealanders: if you are sick and have symptoms, stay home and seek advice about getting a test. The man's death again emphasises the seriousness of this virus if it is not controlled, and the consequences it can have. There have now been 25 COVID-19 related deaths in New Zealand. Our thoughts are most sincerely with this man's family and friends during a difficult time, and also for his iwi, Ngāti Raukawa, who have lost clearly a rangatira, who was very prominent in the iwi's history, and they mourn the loss of their loved one. They have requested privacy as they grieve, and we ask that this is respected. Today we have 3 people in hospital with COVID-19. One is on a ward at Auckland City Hospital, 2 are in intensive care, 1 at North Shore Hospital and 1 at Middlemore Hospital. There are now 57 people linked to the community cluster who remain in the Auckland quarantine facility, and that includes 27 people who have tested positive as well as household contacts. Since the 11th of August, when the first case was notified in this Auckland outbreak or cluster, our contact tracing team has identified 4,139 close contacts of cases, of which 4,046 have been contacted and are self-isolating. We are in the process of contacting the rest. And as you will know, immediately after this stand-up, we have, and also in this room, a presentation of the National Close Contact Service, which I heartily commend to you. With today's new case and 4 additional recovered cases, our total number of active cases is 79, and of these 27 are imported cases that were identified in managed isolation facilities. The other 52 are community cases. And our total number of confirmed cases is now 1,451. Yesterday, our labs around the country processed 9,088 tests exactly, and that brings the total number of tests completed to 881,532. An update now on the case of the healthcare worker at the Auckland quarantine facility who tested positive for COVID-19. This worker had a couple of days ago been genomically linked to cases that were completing isolation in the facility. I'm pleased to say we have now established the exact epidemiological link, and that gives us an indication of how that healthcare worker became infected. The link has been confirmed as being to one of the community cases who was being cared for in the quarantine facility, whose condition required assessment and subsequent hospitalisation. And the healthcare worker went into that person's room to provide care and assess them ahead of hospitalisation. And a review is underway actually at this very point in time. There is a clinical team there to have a good look at what happened in the circumstances so that we can see if there are any lessons to be learned, any changes to protocols, and of course improving our IPC procedures to make sure that the staff there and others in the facility are protected. Our national contact tracing system has recorded 85 close contacts of that healthcare worker from the gym sessions at Les Mills Takapuna, and all have been contacted and are self-isolating. And to date, 80 of those have been identified in our system as having returned a negative test. There have also been 195 casual contacts identified from the gym classes. So far, we have results on 91 of those people who have been tested and returned a negative result also. These numbers will continue to change as more conversations and calls are made, and we continue the investigation. And finally, just 2 reviews that have been released today by the Ministry of Health. Reports, first of all, into this year's influenza immunisation campaign that was undertaken largely through the period that we were in alert levels 4 and 3 and 2 earlier in the year, as well as last year's measles outbreak, particularly the Auckland component of that. These reviews were, of course, commissioned by the Ministry to learn about what had worked and indeed what improvements were needed in the system to improve our overall immunisation efforts. Work is already well underway to address the recommendations. Some is already complete. And I should say that the work for the measles review was carried out late last year and early this year, and we received a briefing from the 2 authors, a very comprehensive briefing earlier in the year. The finalisation of the report was delayed by COVID-19, and the report was only provided to us in the last couple of months, and we've been working apace on the recommendations there. And I would like to say that the recommendations of both those reviews are already informing our COVID-19 response, and particularly our preparation for vaccination once a vaccine is available here in New Zealand. Right, I'm open to questions, and as you know, we've got through till about 20 past.
However, Bloomfield, on the influenza report, it clearly finds communications encouraging people to get vaccinated, only to find there was no stop, put the front line under pressure. The people involved, obviously, in putting out those communications include yourself and the Prime Minister. How was this allowed to continually happen when clearly the Ministry's own emails showed that it knew what the situation was?
Well, actually, we were, of course, wanting to continue to encourage people to be vaccinated. And as I recall at the time, we were certainly receiving messages that there were problems with distribution. Can I say the report also identifies that the biggest challenge with the distribution is that early, for the first 2 or 3 weeks that the immunisation campaign happened, the orders were being filled on a first-come, first-served basis out from the provider, as they usually were. And as soon as we became aware of the issues around maldistribution, as it were, of the vaccine, we then put in place a national process, an additional step, whereby the Ministry of Health worked with the provider to go through all the orders to make sure that vaccine could be distributed right around the country and wasn't all just sitting in one place and not being used. So I guess it was a balance of wanting to encourage people to be vaccinated, and the outcome of that and the overall campaign, of course, was that we distributed 800,000 more vaccines than we had the previous year, which was already a record number. So the outcome was the right one, and I do want to acknowledge, and that's why we asked the reviewers to talk with a number of people in the sector, that it did create issues for providers and for people, and of course what we want to put in place is systems that prevent that happening again.
But the frontline workers, what they were saying and what was being repeated to the public, there was a huge disparity between those messages. So were the public misled, and does there need to be an apology for that?
I don't think the public was misled at all. When we became aware of distribution issues, and those were raised with us both directly and of course in the media, that's when we stepped in. And on our daily briefings, we were clear about where there were issues around vaccine not being available and what we were doing about it. Just again to reiterate the message that we weren't wanting to discourage people from being vaccinated, and I think we've had a good outcome in that respect, that many New Zealanders have been vaccinated, far more than ever. Final question?
Workers who are raising concerns, but they feel like they were being ignored.
I don't think they feel like they were being ignored, and in fact I've regularly engaged with frontline workers and in particular with GPs and done a number of sessions with them, including one at the time, so I could hear what the exact issues were and we could get to the bottom of them and address them.
According to staff, Nigel Huirama Te Huki, 54, the brother of Alan Te Huki, died on Tuesday afternoon at Waikato Hospital ICU unit, almost 2 weeks after his older brother died at Middlemore Hospital. I mean, has the Ministry been in touch with the family? It must be devastating having 2 deaths in 2
Yes,
weeks.
I can't imagine how devastating this is for this whānau, and we haven't been directly in touch, but clearly we have passed through our condolences to the family, and also, you know, just to acknowledge also he was clearly a prominent figure in the local iwi, Ngāti Raukawa, so This is a huge loss, and it just goes to show that even though this outbreak has had a relatively small number of cases compared with our earlier outbreak in the year, that people still, and particularly people who have got pre-existing conditions, are susceptible to poor outcomes from this virus, and this has been one of the key drivers of our response and the reason why we responded so quickly with the alert level introduction of 3 in Auckland and 2 elsewhere in the country. I certainly just want to reiterate our condolences through to this family.
What do you know about Nigel? What can you tell us about?
I don't have any personal information, and again, I think there's a fairly full story already in the media. The whānau and the iwi have been interviewed, and I'd just like to point you to the comments they've made.
To go back to the strategy, if I recall correctly, it was because people were talking to us off the record anonymously from PHUs and doctors and GPs, who then raised it in press conferences with the Ministry of Health. So how is that front-footing issues if it takes the whole go-around before you finally admit that there are breakdowns in the vaccination distribution chain?
So I think you referred to the strategy, but do you mean the vaccination campaign?
Yeah,
Yes, yeah. Rest assured that in addition to the people who are raising issues through the media, there are many people raising them directly with us, and I have a direct line to senior GPs in the country, and they have my number on speed dial. So at the time we were receiving the information back, in a very timely way. And I think if you go back again and look at the statements that we made at the time, we were, as we have right through this, proactively addressing and identifying what the issues were. We know we had them earlier in the year around PPE distribution as well, and so we were quite open to saying, yes, there are issues, and here is what we are doing about it.
But it was only after questions that it was the private providers who had taken that first inload of vaccinations that came to light. So
yes.
why not front foot that?
It wasn't just the private providers, I should say, first up. The second is the distribution system for influenza vaccine has been the same for some time. This year, of course, it was operating in a different context. We brought forward the start of the influenza vaccination season, and we started by confining the vaccination just to people who were able to be publicly vaccinated, the higher risk groups. And it became apparent within a space of a couple of weeks that there was a problem and that vaccine was going out the door to providers, not just private providers, but also to general practices, and then was sitting there, and we needed to step in and put in another process, and that's what we did. Please.
How is Auckland Uni allowed to operate with classes with sizes up to 300 students in level 2.5 from next week?
I don't know the exact details. I did see a story about some students bothered about the fact they would have to be back face-to-face from next week. I am assuming that the university knows exactly what the expectations are around physical distancing, and that they will be implementing that, and in particular that it should be groups of no more than 10 people together, and so I'll be interested to look and we'll follow up if there's any sense that there will be larger groups in any of the lecture theatres.
Would you consider making masks compulsory for these lectures that have up to 300 students in them?
Well, in the first instance, under alert level 2.5, there can't be 300, and there can't actually be groups more than 10. At the moment, compulsory mask use is expected on public transport and on flights, and in other settings it's strongly encouraged where people can't easily physically distance.
So the Ministry of Education is sort of linking universities in with schools and communities like that, but students is telling us that they're not like schools and that they come from all different parts of the city. They're from all different sections of society, and then they could, I guess, therefore spread it all over the city. Do you think that universities should be treated differently from places like primary schools?
Look, I really do think that's an issue for the Ministry of Education. They have more expertise than we do in that, and of course we provide advice on their request.
And do you have any advice for students on ways to physical distance during lectures?
Well,
and
again,
on campus?
yeah, I'm
Because
assuming...
we're hearing students, especially in residential facilities, that there's not really any physical distancing going on.
I haven't had any information about that.
Dr. Bloomfield.
Thank you. I'll just go down the back here.
With regards to the healthcare worker review, is it your, are you aware whether or not the person was wearing full PPE when they went into to do this assessment that you talked about before? And what do you know, can you give us some more detail about what that review might look like, and whether you think that processes in your initial uptake were actually followed?
I don't have information about any aspects of the interaction, including use of PPE. I can say, having visited that facility, there is very strict sort of requirements and enforcement around use of PPE, but that's exactly what will be happening, and the review will be a clinical review, so it will assess use of PPE, the exact nature of the interaction. The good thing is that the nurse, of course, has a clear recollection of that and will be able to provide that information, and I would expect we'll have the results within a few days.
Has there been anything further from the Les Mills cluster, well, this sort of subcluster of that?
Nothing in the sense that all of the close contacts who have been tested, and that is the vast majority, have returned negative results, as have the family members of the nurse, so we haven't seen any wider spread from the infection of that healthcare worker.
Dr. Monk,
Sorry, we'll go down here.
Monday's a levels announcement that was led by the Prime Minister, but we didn't hear from the Ministry of Health on that. Why not? And are you concerned that a public health announcement is being politicised?
Well, I'm not concerned about the latter, and the main reason was the Prime Minister was in Dunedin and I was in Wellington, and I made myself available to the media the next morning to do interviews, and in fact I got asked about this very issue, about whether it was being politicised, and the comment I made was, well, of course I'm not a politician, I'm a public servant, and I rehearsed the advice that I had given and the extent to which that had informed Cabinet's decisions. Sorry, one here. And then
Dr. Bloomfield, how disappointing is it for you to see people within the Māori community continue to disbelieve the seriousness of COVID-19, despite the fact there are now two kaumātua, prominent Māori, who have passed away?
Well, I think a couple of comments there. First of all, I think that many, if not most people in the Māori community are not just convinced about the significance of COVID-19, but are actively supporting efforts to control it. And we saw earlier in the year that iwi were one of the first groups to step up and protect their kaumātua and kuia because they saw the potential impact it would have on these people. So that's the first comment I'd like to make. And second, I don't think that the disbelief in the virus or in its significance or in the fact that it's a problem is confined just to Māori. I think we see that across a number of groups in society. And I guess the key point I would just like to make is the deaths that we've seen in this family and from this latest outbreak do reiterate just how significant this virus is. We've seen a death rate in New Zealand of between 1% and 2%. That's about 10 times the death rate of seasonal influenza. So it's a serious infection, and that's when we know we've been able to provide the very best intensive care for these people and the other care they may need.
Modelling by Sean Hendy has shown that the chance of a case elsewhere in the North Island is as high as 40%. I think last week you gave a figure of 25. How do you reconcile those two? Have you seen that modelling, and how do you reconcile it? Yes,
I have seen the modelling, and also I had a chance to meet Sean last night for the first time, which was great. So the 25% figure is essentially an average across the country. There's a difference between the North and South Island. So this was about a week ago. Outside of Auckland, the risk was around 30 to 40%, and in the South Island, somewhere around 10 to 20%. So there was a difference. In both cases, obviously, it's not zero, and it will keep declining as days go by when we don't find cases that have been seeded outside of Auckland.
And just on the measles epidemic, or the measles report that's been put out, why were Pacific people particularly let down by, in that outbreak?
Well, one thing that I think we've got to think about a little further on this is it was a bit puzzling that actually our data showed that Pacific children had the highest immunisation rates, including for the measles vaccine, prior to that outbreak. And I think that what the higher rates of infection amongst Pacific people reflect there is that they have a larger group of unvaccinated, that's between that 15 and 30-year-old group, and that's the group that we are particularly starting and focusing the current campaign that's just starting is capturing that group, and in particular Māori and Pacifica, and I think that's what's played out in South Auckland. There was just more measles circulating amongst that group, and therefore they were infecting children.
Does the ministry, though, after this report, take responsibility now for that outbreak?
Well, I don't think that anyone in particular is responsible for the outbreak. Of course, what our accountability and responsibility for is managing it, which we did. We turned it around. We vaccinated a large number of children and teens and others to help manage it. And now we have what was a known gap. We have got the funding for and initiated this specific campaign to close that immunisation gap in 15 to 30-year-olds.
So
Dr.
here-
Bloomfield,
How much is that funding?
I think the funding is about $40 million for that. I'm just looking towards the back. Yes, $40 million for that total initiative over the next year, including the cost of the vaccine, which is over 300,000 additional vaccines.
How can you
Dr.
be
Bloomfield,
confident with this?
emails we have seen show the Ministry of Health was aware of flu distribution issues a day before you announced the new flu campaign on March 18th. Why did you not tell the public about this?
Well, we were telling the public about the flu campaign. It's hard to... I myself didn't see emails about flu distribution issues before we announced the campaign. We were keen to get the campaign underway. We had the vaccine. We wanted to start vaccinating people, remembering that at that point in time we were just about to go into a alert level 4 and 3 posture, and we wanted to get the vaccination out there.
And the measles review is scathing on many issues. How can the public have confidence you're on top of all of this?
Well, let me just say, I don't think the reports are scathing. The reason these reports and a number of other reviews have been commissioned, mostly by me, is so that we can find out what went well, find out where there are gaps and address them. And that's why we are making the full unredacted reports available. There is nothing to hide here. That's why we went and spoke to all the people who were relevant and were key stakeholders. And the whole idea here is that we learn and improve things. And there's no better time to be doing this than at a time when we are starting to plan and prepare for vaccinating the population when we have a COVID-19 vaccine.
Dr. Novell.
Sorry, did you?
Yeah, last time we spoke, the bereavement sort of cluster or subcluster had just been revealed, and your dashboard was a flashing orange alert.
Mm-hmm.
There haven't been many new cases in that
Yep.
bereavement subcluster recently. Do you feel confident you've ring-fenced that? And I guess what colour is your dashboard at the moment?
Yes, I think we're increasingly confident we've ring-fenced that cluster and our subcluster and the other subcluster. I'm very pleased to see so far we have no further indication of further infection from the healthcare worker. So if I was to characterise my dashboard now, and maybe President Trump will pick this up as well, I would say amber-green.
The Herald
Thanks.
reporting,
A couple more questions,
Dr.
please.
Bloomfield, this is not the first time that what's been said in the daily press is at odds with what is actually happening on the ground. It happened with PPE, it happened with the testing of border workers, and now with this influenza vaccine. How can the public and frontline health workers have faith that what is being said in the daily press conferences is actually accurate?
So what I just want to reiterate is what I say when I'm up here speaking with you is based on all the information I have. I'm not hiding anything. If more information becomes available, of course I share that. If there are issues, and some of those issues are brought to my attention in these fora, then I act on them.
the
Please.
Herald are reporting that the university said physical distancing is doable in lectures up to 300 people. Do you think that's the case?
Well, I'll be interested to see, and we'll follow up to find out just how doable it is and how they intend to do it. Final question,
Given
Dan?
these failings with measles and flu, how confident are you that our health system can roll out a vaccine for coronavirus?
Well, I just want to make a comment first of all on the use of the word failings. That the system doesn't get everything right does not represent a failing in every occasion. It would be a failing if we didn't do a review and find out how to improve.